Americans are currently investing in cosmetic procedures.
Dr. Stephen Williams, Vice President of the American Society of Plastic Surgeons, joining us now to discuss the current plastic surgery demand, and also he has safety tips for those seeking a popular cosmetic procedure. Doctor, thanks for joining us.
Thank you for having me.
You would think at a time like this, when inflation is up, that there would be fewer people seeking these medical procedures, that they don't have as much discretionary income, but you say there's been an uptick. Why?
The ASPS has recently released data that shows that plastic surgery, cosmetic procedures continue to be very strong in the marketplace and tend to be sought after. The reason that we think really is people have really turned to investing in themselves. It's a matter of feeling the way they that they want to look the way they feel, and they're taking these opportunities of maybe breaks from work or a little bit of extra revenue to really spend those resources on themselves.
Another reason that I saw from the American Society of Plastic Surgeons is because during the pandemic, people weren't traveling as much, they weren't going out as much, so they were able to save more of that discretionary income and now use that money toward that. Doctor, we want to show the 5 most popular surgical procedures currently. If we want to throw that up there so that our viewers can see them. Liposuction, facelift, breast augmentation, tummy tuck, and then breast lift. What do you make of these top surgical procedures, doctor?
Again, these are procedures that people are seeking out to feel better about themselves. There's always been an increase in minimally invasive procedures, but recent data is showing that people are doing larger procedures because, again, as you've mentioned, they're taking advantage of the fact that they have additional resources from the pandemic. They have additional time to recover. And a lot of times these larger procedures, if you have an extra week or two to bounce back after surgery, it makes sense to do it at that time in their lives. They have to find the right moment, and the post-pandemic period seems to be perfect.
We talk about safety, doctor. Believe it or not, I think everybody knows someone who's undergone some kind of a cosmetic procedure, I'm sure. I've had friends even going overseas to have these procedures done because they're cheaper to have done over there. What is your main advice for anyone who is seeking any kind of cosmetic surgery?
So first and foremost, patients should seek board-certified plastic surgeons. And the reason why is the training and the standards that we're held to as a board-certified plastic surgeon are designed to ensure patient safety. Secondly, patients should seek out physicians that have substantial experience performing the procedures that they're interested in. And they should find providers that spend the time and energy to listen to their concerns, explain the risks, benefits, and alternatives, and really have a chance to interface with those patients. It's incredibly important.
There has also been an increase in people seeking out the Brazilian butt lift surgery, which can be quite dangerous if you don't do exactly what you just recommended for people. What is that procedure itself, and what is your recommendation for people who want this done?
Yeah, the Brazilian butt lift is a term that people refer to. What it really is it's taking fat from parts of your body and then placing it in the buttocks and hips to enhance the overall shape and contour. And the American Society of Plastic Surgeons and international organizations have spent an enormous amount of resources and energy making this procedure safer. And part of that education, not only for patients but for physicians, involves technique changes, follow-up, and imaging studies that allow this procedure to be done in a safe manner. And what we've seen in the last 2 years because of these efforts is this operation has actually become much, much more safe. It's important for patients to have those discussions with their plastic surgeon and to make sure that their plastic surgeon's aware of these innovations and changes and really up to date on the current knowledge for this procedure.
I think this is all great advice. And, you know, it's interesting because I think when people go through these procedures, they don't realize, or they might not recognize, that these are medical procedures, these are surgeries, that, you know, there could be serious complications if you don't go through the right avenues. Dr. Williams, we appreciate your counsel. Thank you so much.
Thanks for your time.